Thanks very much. So as we've just heard, this is all about the sort of risk factor information that we receive during pregnancy, but we thought it might be helpful just to give a little bit of background, some of the science behind it, and some things that you thought might have been a risk which actually are probably perfectly fine. To start with, just to talk about the context of the modern pregnancy compared to in previous years. For a start, it's relatively low risk these days to have a baby. However, it wasn't that long ago, about the 1930s, when safe caesarean sections and penicillin came in, that it actually was quite risky to have a baby. And so our pregnancies today, our grandmas and our great-grandmothers would have had a very different, a lot more risky environment. And there's still some of that fear attached to pregnancy and birth that we hear about today. There was also the thalidomide scandal in the late 1950s, early 60s, which was a morning sickness drug that a number of women were taking, and around about 1 in 4 of those women had babies with birth defects. It kind of gave us the idea that sometimes things that we take during pregnancy can affect our baby. Then there's Agent Orange from the Vietnam War and Chernobyl as well. Things that we've been exposed to that might affect pregnancy. It kind of stuck in our consciousness. Also the increasing surveillance of pregnancy, and by that I mean scans, particularly in the private system at the moment. If you're pregnant, you could be scanned up to every 2 or 3 weeks. And with that, it comes the opportunity to worry about what might be wrong this time as well. There's also a lot of medico-legal context behind a pregnancy. We don't often see this as a patient, but in private and in the public system as well, your obstetrician or your care provider is dictated to by insurance and by sort of legal considerations of what they can and can't do. And really, when we're talking about a risky pregnancy, they will be dictated by what they can safely do and how they can most carefully guarantee to get your baby out safely. Also social media. These days you hear about anything, you can go home, you can Google it, and you can sort of find out what all these scary things that might be up. So this is the world that our pregnancy is in, and no wonder risk information is really quite frightening. But ultimately most women want to do what's best for their baby. It's just unfortunately through all our medical advances we still don't know the recipe for the perfect baby. There's still no way to guarantee that everything will go completely fine. And sometimes we don't even know the cause of problems with a lot of the risk. So it's about accepting that there's a level of risk out there but not letting that dictate our pregnancy and frighten us. So to talk about risk today, we've got a traffic light system. I'll go through a few risk factors that you would have heard a little bit about. If there's a red light, it's something that we want to try to avoid. An amber light is proceed with caution or ask your care provider for more information on these sort of things. And green light means it's pretty low risk, you're pretty okay. Starting with the big doozy, which is alcohol. And the Australian guidelines currently say that for women who are pregnant, not drinking is the safest option. Now, about 2 lines below that, it says that if you are drinking in low amounts before you know that you're pregnant, then you're unlikely to have done any harm for your baby. So it's contradictory. It's really, really confusing. And everyone's got an opinion on this, as you know, during pregnancy of whether it's okay or it's not. The fact is that there's a lot that we don't know. And you might know even without being pregnant. Sometimes you can have a glass of wine or a beer and feel fine. Other times it can really hit you. And that's the sort of thing that we still don't really know much with individual differences in alcohol. So the best option, given there is a lot that we don't know, is to avoid alcohol from the moment that you find out you're pregnant. And if you're trying to get pregnant, it's best to really cut down on the alcohol. That way you're not stuck in that situation of feeling terribly guilty when you do find out that you're pregnant if it's been a really big party month. There's also a lot of new research that's coming out on genetics and the way that we process alcohol. So when that research comes out, I think we'll start to learn a lot more. Smoking we know is bad. However, there's still 12% of women who smoke during pregnancy, and it can be a really, really difficult thing to quit. A lot of the normal ways that we'll say to quit smoking with different medications and things are not necessarily safe for pregnancy. So pregnant women can be left in a bit of a bind. They don't really know how to quit smoking, but they know that it's bad. What we found with one of our studies is that it's never too late to quit. Quitting right up until you have the baby can have a lot of benefits further on. And we found in one study that up to 4 months into the pregnancy, women who quit smoking then, their babies were the same as the babies of mothers who never smoked. So it's something that women lose confidence with sometimes. They think, oh gosh, I'm a bad mother, I've been smoking. Any time that they can quit through the pregnancy is better than not quitting at all. Caffeine. Now, we get a green light here, and this confuses me because often I hear people saying when I go out to cafes, they say, oh, I can't have coffee, I'm pregnant. You can have coffee. You can have around about up to 300 milligrams a day of caffeine. And it's about 60 to 120 in a coffee, depending on where you get it. If it's instant coffee, it's got less caffeine. If it's from a Nescafe, etc., stronger, it's got more caffeine. Generally, if you really love your coffees and you're pregnant or you're trying to become pregnant, try and cut down now because, as we know, it's another addiction that can be really difficult to quit. And be aware of the other things that contain caffeine. So you might think, well, I'm having 2 coffees a day, so that's fine. But if you're also drinking a Red Bull or a Mother or all the energy drinks, massive amounts of caffeine in energy drinks. Tea. Sometimes people will say, oh, I have to have tea because I'm pregnant. Well, it's caffeine in both, less caffeine, but still there. Coca-Cola, Diet Coke, and even chocolate also has caffeine. So caffeine's okay in low doses, but just be aware of how much you're taking. Cat litter. There was a study that came out a couple of years ago on toxoplasmosis, which is a parasite that's found in cat poo. For some reason, this parasite only breeds in cat stomachs. And it is very dangerous when you're pregnant, but it's not dangerous really at all to a healthy adult. You can get it and not know that you've got it, no symptoms at all. So if you do have a cat, you've probably had it without knowing it and you're probably immune. But it can be linked to quite serious health problems for the baby, so we want to avoid it. So although it's not necessarily a risk that you don't need to get rid of your cat or anything like that, but if you're gardening or changing the cat litter tray, all these things you've still got to do, even if you are pregnant, make sure you use gloves. Listeria. This is a really nasty thing. Contrary to popular belief, it's not lurking in soft cheese all the time. I think people think with processed meats and soft cheese that the listeria is just always in there. It's not. There are outbreaks, and it occurs in outbreaks. And you'll hear all about it. It straight away hits the news when there is a listeria outbreak because it is so dangerous, especially for pregnancies, can cause miscarriage. The reason we say to avoid it altogether and not proceed with caution is there's always the first person to take it before the outbreak is known. So the best thing to do, and we're talking about soft cheese and any unpasteurised dairy, you can see that on the side of the packet, salad bars at supermarkets, and soft serve. Pate is best to be avoided in pregnancy more because of the vitamin A from the liver content. Raw fish and sushi is about getting E. coli and various food poisoning. It's not necessarily going to harm the baby, but with the dehydration that often comes with those sort of things, can be very dangerous. Diet soft drinks. There was a lot of bad publicity for Diet Coke. This ingredient of Diet Coke, aspartame, and there was a bit of a hoax theory that there was ant poison, formaldehyde, all sorts of things in Diet Coke. There's a study that found a very small link with drinking Diet Coke in pregnancy and preterm birth. However, it kind of ended up that the effect that they saw with preterm birth could probably be explained by the smoking of the mothers there as well, which smoking is obviously another thing that causes preterm birth. So in the end, again, one of those things you kind of want to cut down on from a general health perspective. If you have PKU, it's something that you'll know about if you've got it. If you have that, that's the exception. Then you should not have the aspartame at all. Vitamin D, something that you hear a lot about these days. Deficiency in pregnancy is very common because when you're pregnant, you tend to cover up more than other times. And there's links with pregnancy complications, links with a lot of health problems with low vitamin D. Also important once you do have your baby to make sure that your baby gets a little bit of sunlight as well. We think around about 5 to 10 minutes a day is not enough to get burnt or get any of the damaging effects of the sun, but it's important to get your vitamin D. And you'd be amazed in a place like Australia with beautiful sunny days how frequent the vitamin D deficiency is seen. Antidepressants is a big one. So we've got an amber light on here with proceed with caution. Antidepressants, commonly a particular type of drug called an SSRI, a selective serotonin reuptake inhibitor. What these drugs do is they block the reuptake of serotonin, the feel-good chemical in our brains. And so there's a lot more it stays floating around in our brain for longer, makes us feel good. The dosage differs remarkably. A really important thing when people talk about antidepressants, each person could be very different in terms of the dosage and the type of drug that they're on. So when we're thinking about the risk, obviously the risk of someone who's on a very heavy dose will be very different to someone who's on a very low dose. It's about weighing up the risks of untreated depression as well. So there was a study that found that there was a small link with preterm birth with taking antidepressants. However, the group who had untreated depression also had a higher risk of preterm birth. So here's where it's really good to talk to your care provider and have a discussion. Oh, preterm birth is being born before 37 weeks. Yeah. Paroxetine is the one exception, a drug called Paxil. That's something that you should never take during pregnancy. But the most important thing here, if it's for yourself or for someone who you know is pregnant, never stop suddenly. Never say, I'm pregnant now, I've got to stop, and stop taking it straight away. Always talk to your doctor first and make sure that it's a managed, if you do want to come off, that's well managed, or if you're going to stay on, that you're on the right dose. Stress is something that you really don't hear about the same way that we hear about smoking and alcohol. I call it a bit of a sleeper risk factor. But again, it's something that can cause your baby to be born early. Also is linked to behavioural problems, and particularly the way that your child might react to stress in their future. Very common in pregnancy, and also pregnancy can cause it. You've got things like money problems, problems with your relationship, moving house, all those sorts of things that happen when you're bringing a new life into the world. So we can't avoid it, but we really need to learn how to manage it, because this is something that really can cause some problems. Social support, asking other people for help, a lot of light exercise, going for a walk regularly, clear your mind. If you're into it, yoga, relaxation, that sort of thing. Asking for help and accepting it, and especially postnatally, it's something you've got to learn how to do, to learn how to let someone come over and do your laundry or wash dishes for you. All those things we don't really feel that comfortable normally doing, but are very helpful to reduce the stress. Reading, magazines, TV. If you work long hours or you've got a very stressful job, talking to your employer about the fact that you are pregnant and how you can reduce the stress caused by your work and perhaps reduce your hours if you are working long hours. Hiring a gatekeeper, a partner or someone close to you who can deal with some stressful things in your life for you. And positive thoughts, kind of trying to just reassure yourself that things are going to be okay, you're going to get through this, all those more happy things. If you are feeling overwhelmed, the Beyondblue website's a really great place to start, and I'm sure they've got a stall here somewhere as well. They have a lot of resources and even ones particularly aimed at partners as well. And we know that about 1 in 10 dads will get postnatal depression, so it's a really good time to start talking about your partner's well-being and stress in pregnancy. Also special things for FIFO families and for those who've got a history of depression, anxiety. This is the late Professor John Rampono, who was a wonderful psychiatrist and lovely man at King Edward Hospital. And he said to us a couple of years ago, the first time that you care for your baby is not the first time you hold your baby, it's while you're pregnant. It's a really nice, positive way to look at things. Just create the best possible womb that you can for your baby. Instead of all the don'ts and you shouldn't do this and you mustn't do this and all the advice that you get of people telling you what to do, think about how am I going to make my belly the most comfortable place and the safest place for my baby. So these positive messages, this is, I guess, what I'd like to see as a pregnancy researcher. The positive messages about this first environment being the womb. More celebrity endorsement. A lot of celebrities go out drinking, smoking, all these sort of things. If they came out and said, you know what, I'm pregnant and the best thing to do for my baby is to do this. Or to say, Chrissy Swan a couple of years ago caught with a cigarette while pregnant. Just to be able to say, it is really hard to quit smoking. And I do struggle with it. Some of those things will just help other people to be able to understand. Again, some good days, some bad. That's kind of pregnancy, that's child rearing as well. I'd like to see more empowering of women, so asking people how they're going, not telling them what to do. Thinking about promoting the message of the right thing for you and for your family, your baby. I'd love to start in high school. You learn about how not to get pregnant, but we learn nothing about healthy pregnancy in high school. And about modelling positive behaviour, breaking some of these cycles that we see in families where the same problems keep repeating themselves over generations. More of an acceptance culture where most of the time what you're doing is probably right. If you love your child and you do whatever you can to keep them healthy and safe, you're doing an amazing job. And what I'd love to see is the child health nurse starting with antenatal visits, coming to houses in pregnancy and really helping people get set up, help them understand what's about to happen, especially for their first baby. Expense, it's too much. It's too much for individuals, it's too much for the government and the community. So these are things that we've really got to try and say. It's very, very important that we focus on mums and bubs and families and individual support. I don't think people always want to join a group. So in summary, we can't eliminate risk. We've just got to accept that there is a level of risk, but it's much better to focus on the healthy pregnancy and everything that you can do right rather than what might go wrong. Our greatest source of support is each other. There's a lot of attacking each other and mothers, especially if you get on the internet and saying, oh, you shouldn't do this, and really kind of nasty stuff online. But really we should be helping each other and really focusing on supporting each other. And in general, just relax. If you are pregnant, enjoy this unique time of life as much as you can. I'm happy to take any questions afterwards, but also if you're 35 or older, or you were 35 when you had your first child, we've got a study that's desperate for participants at the Telethon Kids Institute. We want to know all positive stuff about being an older mum, because it's always quite a negative approach that you hear in the media. So if you are in that boat or you know someone who is, please take a flyer. Thank you.